Let's talk about Achilles tendon repairs. Now, you may only associate an Achilles tendon rupture with elite athletes such as Kobe Bryant or Ryan Howard, but you would be wrong. Actually, Achilles tendon ruptures affect recreational athletes the most. They account for 75% of the total repairs that are completed. Males are affected more so than females, especially those between ages 30 and 40. The injury itself can occur due to repetitive overuse or to a trauma. So what might a 40-year-old male recreational athlete look like? Right here, we have the weekend warrior. Now, sports that commonly cause an Achilles tendon rupture include basketball, football, racket sports such as tennis, volleyball, and running. Or, of course, if you are a mythical Greek hero, you could sustain an injury because of a fatal arrow shot to the back of the leg. So before we get too much further, let's discuss the anatomy and the region where the injury occurs. So right here, we have the gastrocnemius muscle and the soleus underneath it. These two comprise what is commonly known as the calf muscle. Now, these muscles form a common attachment into the Achilles tendon right here, which runs the whole way down the back of the leg to the calcaneus, or the heel bone. The area of the tendon that is typically injured during a rupture is located approximately 2 to 6 centimeters above the insertion on the heel. This right here is what we call bad. Now, surgery is the most common way to address the injury, and surgeons can use a variety of suturing techniques to repair the tendon, including a zigzag suture that is shown here. Following surgery, patients are typically not allowed to weight bear on the affected leg, so they will be placed in an immobilization cast for about 4 weeks and will have to walk on crutches. And that's where this guy comes in, your friendly neighborhood physical therapist. He will be a very important part of your rehab back to full strength and function. So the major PT goals include protecting the site, reducing pain, increasing range of motion through manual techniques and stretching, building strength through a variety of resistance exercises, improving balance and proprioception using single leg stance and unstable surfaces, and eventually a gradual return to activity or sport through a progression of walking, running, agility, and finally sport-specific exercises. Now, all of these things that we just listed will happen gradually over time, so please be prepared to be patient. This will take some time. So if you had your surgery in December, it will take until around June until you can finally begin returning to your sport or activity. On average, it takes about 6 months for the full rehab process to be complete, assuming that the physical therapy goes well and there are no complications. But if you put in the time and effort, you could potentially go from the weekend warrior here down to the elite athlete status down here.
Results may vary. Elite athlete result not typical. No NBA players have endorsed the making of this video. This has been a presentation of the Pitt School of Physical Therapy.
Come on and slam, and welcome